For this procedure, general anesthesia is recommended to intubate the patient. The patient must be in a left lateral decubitus position. The first step is to carry out an osso-gastro-duodenum fibroscopy in order to rule out the presence of duodenum, gastric, or esophageal lesions, which are indications against the placement of the intragastric balloon. In our experience, the presence of a hiatal hernia is not an indicator against the placement of the balloon. The Heliosphere NewTek Kit. This system includes one radio-opaque intragastric air-filled balloon with a triple-layered polymer pouch covered with a silicone envelope. The balloon, in its protective cover, is accompanied by an introduction kit, which is pre-connected to the balloon, as well as a 60 cubic centimeter syringe. Both together are used to fill the balloon. Implantation procedure. First, lubricate with a surgical gel the protective cover and a catheter which is pre-connected to the balloon. The balloon is then introduced in its totality into the mouth through a teeth holder. Then, using the index finger as a guide, move the balloon through the Killian area. With the help of the graduated catheter, gently pass through the esophagus to the stomach. The doctor should keep his index finger in the patient's mouth to help avoid bending the catheter. Should you encounter difficulty during the balloon's passage through the esophagus, avoid forcing with the catheter, as this would cause the catheter to disconnect from the valve of the balloon, rendering the system unusable. Therefore, use an endoscope to help move the balloon correctly into the stomach and to help control the good positioning of the balloon. The blue valve must be located 2 centimeters below the cardia level. Remove the blue-colored safety tape by opening the flaps and then unrolling the thread from around the introduction kit. This will allow you then to pull on the thread. Slowly and continuously pull the chin stitch thread in order to pull away the balloon's protective sheath. Near the end of the thread's pull through the catheter, you may feel a slight resistance from the thread, which is not abnormal. Continue pulling until the thread is removed entirely from the catheter. After, using the endoscope, check that the protective sheath has been completely removed. Otherwise, you absolutely must remove entirely the whole device and use a new Heliosphere NewTek bag system. Filling the balloon. To fill the balloon, first screw the 60 cubic centimeter syringe into the anti-return valve of the insertion catheter. Then, slowly inject air using the 60 cubic centimeter syringe to inflate the balloon. One air injection should be done slowly and last a minimum of 10 seconds. There are 2 kinds of Heliosphere NewTek intragastric balloons. The NewTek 600, which is inflated by using 10 syringes, representing 600 total cubic centimeters of air in the balloon. The second is the NewTek 720, which is inflated by using 12 syringes, which represents a total of 720 cubic centimeters of air in the balloon. Releasing the balloon. Once the balloon is filled, unscrew the stainless cannula of the anti-return valve. With one hand, slowly pull the cannula, while with the other hand, maintain the catheter at the exit area of the teeth holder. Retract the inflating cannula inside the catheter, corresponding to the black mark of the cannula. Then, slowly pull on the filling catheter. This will allow the release of the balloon at the cardia level. The entire procedure must be carried out under endoscopic control. Once the balloon is released in the gastric cavity, check that the inflating cannula does not exceed the distal end of the catheter. If it does, it could damage the esophagus during the removal of the introduction system. Then, delicately remove the introduction system under endoscopic control. Using the endoscope, check both the integrity of the balloon as well as its good positioning under the cardia level. Do not try to place the endoscope behind the balloon. Finally, withdraw the endoscope after this final check. Balloon extraction procedure. The balloon must be removed after a maximum period of 6 months. General anesthesia is also recommended for this procedure. The patient must be fasting and intubated in a left lateral decubitus position. lubricate the endoscope with anesthetic gel xylocaine or KY. Then, using the endoscope, check the condition and integrity of the balloon, as well as for the absence of digestive lesions. Presentation of the extraction kit. This extracting equipment is supplied in sterile packaging and for once-only usage. This kit is made up of a puncture suction catheter and a dedicated dual-grip extraction forceps. Puncturing and deflating the balloon. Using the endoscope, locate the blue valve. Introduce the supplied needle into the operating channel of the endoscope, and then make multiple punctures to the balloon around the blue valve. Do not yet aspirate the air of the balloon. Each time the balloon is punctured, position the catheter of the needle perpendicular to the wall of the balloon, puncture, and then retract the needle. It's better to perform the last puncture in the area adjacent to the blue valve. Connect the catheter to an aspiration tube to completely deflate the balloon. A minimum of 5 minutes must be taken to deflate the balloon. This minimum time is essential for the successful completion of the procedure. Extracting the balloon. Introduce the extraction forceps into the operating channel of the endoscope, and then check that they are functioning properly. Position the extraction forceps on the most pronounced fold facing the cardia orifice and as close as possible to the blue valve. Open the forceps completely and close the jaws around the balloon fold so as to obtain a maximum grip on the material. Bring the material as close as possible to the endoscope to prevent any trauma or damage to the cardia orifice by the forceps. Hold the extraction forceps firmly to obtain a solid forceps endoscope assembly. This step is important as it allows you to pull on only the endoscope during the extraction. Pull at a moderate, constant speed. Do not release the forceps endoscope assembly until the balloon passes through the cardia orifice. Once the balloon has crossed completely the cardia orifice, bring the balloon progressively back up the esophagus, once again using a constant, moderate speed, and then cross the Killian's area very gently. Finally, withdraw the balloon from the mouth. Using the endoscope, examine the patient after the balloon has been removed to check that there are no esophageal or gastric lesions, which might have been caused during the removal of the balloon. Here is an X-ray image of the radio-opaque heliosphere NewTek balloon positioned underneath the diaphragm. Here is an echographic image of the heliosphere NewTek balloon